In 2021, the North Carolina Infant and Early Childhood Mental Health Association licensed the Alliance for the Advancement of Infant Mental Health's Culturally Responsive, Relationship-Focused Infant Mental Health Endorsement Credential.
The first step a state takes in licensing the credential is the formation of an endorsement leadership cohort, which is the first group of infant and early childhood professionals to go through the endorsement process within that state.
The North Carolina Infant and Early Childhood Mental Health Association Board and staff selected a group of individuals to form our Infant Mental Health Endorsement Leadership Cohort that reflects the diversity of our state and of the many workforces that promote infant and early childhood mental health.
We are excited to share them with you today. Diane Britz, Gabriel Guyton, Sharon Little, Rowena Muriapa, Suzanne Walker-Wilson, Tamika Watson, and Jody Whiteman.
We had an opportunity to talk with them about their work, their experience applying for endorsement, and their hopes for the workforce of North Carolina.
We are brain builders, we are brain architects, and we know that the first 3 years of life are important and pertinent to a child's social, emotional, cognitive, and affective development.
I'm so grateful for the way delight and curiosity show up in infants and toddlers, and they're wired to feel connected to their people.
And I've seen firsthand how transformative it can be when the child felt truly seen and nurtured and protected by a caregiver.
How much love and that families have for their children and how they want the best for their children. And that's, I think, the most important thing that I've learned from families and kids.
I got to meet this family in person at termination, and it was quite powerful to see how this baby came and gave me a big hug and embraced me in a way that almost not verbally said, "Thank you for the work you've done with my grown-up," to help them deal with some of the difficult things that they were dealing with as they were taking care of me. And it really reminded me of the importance of how we need to work in really being present for the family so that they can be present for their babies.
Direct service skills, and that part of it that I enjoy is working with families and helping them support them to advocate for themselves, as well as working with the parents on the parent-child relationship.
Through the direct service skills, I have learned to observe and listen carefully to babies and to their families. It has also helped me to have a deep respect and empathy for the families I have been privileged to work alongside with, see the families in their context, and supporting them and for advocating for them.
So much of our work requires the skills of self-awareness and contemplation and curiosity, and the parallel process is so important to the work of infant and early child mental health.
The parallel process in relationships and intentionally having that at the forefront of my interactions with others, and so how feelings and interactions in one relationship influence feelings and interactions in another relationship, and how it's happening all the time, and just thinking about the importance of being reflective and how that can impact others.
Like, my intention is always to be kind and helpful, but we know that our intention always doesn't mean that that's the impact we make. And so I feel like reflection and reflective supervision make sure that we have our intention and our impact more aligned as best we can.
As an eating project coach, as well as an early childhood community college educator, the things that I learned and that I engaged in walking through this process enhanced me in both spectrums.
It really strengthened and grounded me in the dietetic work that I love. Just learning more in depth about the theoretical foundation, but also how this theory applies to practice. And it also highlighted ways that I needed to grow as a clinician, and I really appreciated that.
It's really been a nice way to reflect on the work I've been doing over the years. I was able to really focus in on my skill set in a way that I don't think happens every day.
The endorsement process allows for me not just to connect, but also to make sure that I'm staying vigilant about staying on top of what babies and families need and being current, so that when I'm having this community of practice group, I can really be an asset to that group.
Really, the chance to experience this cohort as my peers and as safe folks who I could learn from and with and be supported by was such a gift.
And we've also heard about it from other states and other people, and well, how are they doing that? What does that feel like, or what does that look like? And so to be able to have that opportunity, I think is important, to kind of coincide with other states and what they're doing too. So.
I'm an early childhood systems person. I feel it's important for us to stay connected to all systems of early childhood, and I feel the endorsement allows for us to intentionally focus on bringing cross-sector professionals together.
I think we all wind up in our silos and we get separated from each other in various ways because we're working so hard, not only because of COVID and just all the upstream that we're doing to try to be our best selves professionally. So breaking those down and remembering who we are as a group of people, that across this entire workforce, we really are a team, and having not just unity, but communication and deep respect and ways to connect with one another across all the different people that are serving and building for young children.
We are seeing a mental health crisis in early childhood, as well as families who are struggling to have access to what they need. This COVID has really highlighted how hard that is, and so I'm hopeful that the endorsement process can also help other people feel hopeful, like, oh, here we have skills and tools and a community of people who want to be supportive around what children and families need.
And I also hope that it'll give more opportunity to share resources, support training, and workforce development. And ultimately, I hope that all of this leads to the very best outcomes for young children and families.
To Diane, Gabriel, Sharon, Rowena, Suzanne, Tamika, and Jody, thank you and congratulations. We hope you'll consider becoming an endorsed professional as well.
Learn more by visiting us at www.ncimha.org